Now for DKA versus HHNS. These are both diabetic conditions involving high sugar inside the blood, from a problem with the pancreas and insulin. So let's play a segment from our MedSurg course, and then go into pediatric details.
DKA and HHNS. Well, DKA is more common in type 1 diabetes and HHNS for type 2. So think which letter comes first in the alphabet. Well guys, D comes first, so it's type 1, and H comes second, so that's how you know it's type 2. Now, what is DKA? Well guys, let the name help you. Diabetic ketoacidosis. There is no insulin produced since it's type 1, guys. We have none. The body killed its own pancreas, and as usual, no insulin means no sugar in the cell. Therefore, the body must burn fat for fuel, resulting in fat waste, and ketone bodies are produced. Kind of like how a diesel engine blows off a lot of exhaust, ketone bodies are very acidic wastes. So we have high acid in DKA, or diabetic ketoacidosis. Now type 2, we have few insulins barely working, so HHNS or just HHS, let the name help you. So hyperglycemic, we have the higher sugar. Hyperosmolar, we have very thick dehydrated blood. Guys, huge dehydration here. And non-ketonic, we have no ketones, and S is for syndrome. Now, since the body has barely enough insulin to put sugar into the cell, well, the body burns sugar for fuel, so we don't get those ketone bodies. So guys, think type 2, you have a few insulins working, so no fat burn, no ketones, since the body's burning glucose. Now, typically, DKA has a faster onset, and consequently, it's easier to fix, since the patients are young with type 1 diabetes. And HHNS is a slower onset with older patients. So guys, it's harder to fix HHNS. Now for the causes, DKA, remember the 3 S's like high sugar. So sepsis, like infection, guys, always an NCLEX favorite. The #1 cause of DKA is infection. Second S is for stress like surgeries or even skipping insulin. Guys, kids in type 1 will get the flu or an infection and then boom, end up in DKA. Or they'll go to surgery without increasing their insulin dose and then bam, DKA. And similarly, on the other side, older patients in HHNS commonly caused by illness and infections. So what are the main differences in the signs and symptoms? Well, for DKA, this is super hard, right? Just remember the acronym DKA. So D for a dried body, guys, and high sugar, 250 to 500 from the lack of insulin. Guys, that's a huge key word, 250 to 500 with type 1 diabetics. Now, K is for ketones and Kussmaul respirations, or known as fruity breath. Key words here for the NCLEX, deep, rapid breathing that smells fruity. This is called Kussmaul respirations, so think ketone respirations. So we say, ketones, do you love me? Are you riding? The body is in metabolic acidosis, so the body tries to correct itself, or basically compensate, and get rid of all this acid. It does it by panting like a dog to breathe out all that carbon dioxide, which we call carbon diacid. So remember, we'll see Kussmaul respirations as deep, rapid breathing as the body tries to get rid of all this acid. And the memory trick here is carbon diacid. Now next, our A is for abdominal pain, which is a huge NCLEX tip. HHNS does not have abdominal pain, only DKA, typically on the NCLEX. And our last A is for acidosis, metabolic acidosis, guys. Huge NCLEX key number here. Write this down. pH 7.35 or less. Huge number on the NCLEX. It will always show up on SATA questions.
So ATI mentions a child who has type 1 diabetes mellitus. Which of the following are manifestations of diabetic ketoacidosis, that DKA? Dehydration. So yes, the memory trick again, for DKA, the treatment, just think D is for dehydration. We always treat the dry first. Huge NCLEX tip. Be sure to write that down. So once again, D is for dehydration first. We always treat with normal saline, or 0.9% normal saline. The K is for we kill the sugar next with insulin. And remember, insulin puts sugar and potassium into the cell. A, add potassium even when it's normal. So Hesse mentions signs and symptoms of diabetic ketoacidosis, that DKA. Select all that apply. So ketonuria, ketonemia, dehydration, and acetone breath, those Kussmaul respirations. So clients will breathe out that fruity, rapid breath. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the. Now for the case study on DKA. Miss D is an 18-year-old client with type 1 diabetes mellitus who presents to the emergency department with a 3-day history of nausea and vomiting. She also reports excessive polyuria and polydipsia over the past 24 hours. The provider suspects that the client is experiencing DKA. So question 1, which assessment data should be collected next? So before answering the question, think about the memory tricks DKA. So pause the screen and try your best to answer this question. Okay, so let's break it down. As you recall from the full video, the memory trick for DKA signs and symptoms first start with the D. So D is for dry and high sugar, 250 to 500. And K is for ketone bodies, or ketones, as well as Kussmaul respirations, that rapid, fruity breath. Basically, the body's blowing off acetone. Now A is for abdominal pain, and the last A is for acidosis, or metabolic acidosis. So a pH less than 7.35. Now looking at our answers here. So we have a full set of vital signs, a heart rate, blood pressure, and respiratory rate. We're expecting Kussmaul respirations, that rapid fruity breath to blow off all that acid from the body. The next assessment is level of consciousness, or basically that mental status, as too much acid in the body can change the client's level of consciousness. The next assessment is a blood glucose check. So obviously, we want to see how high the blood sugar is. Next is the labs, so ABGs, CBC, and a BMP, but especially the ABGs here to assess acid-base levels. Now the CBC, or the complete blood count, will show WBCs, those white blood cells. They will typically be elevated and will provide proof of presence of an infection, since DKA is typically caused by an infection. And lastly, a BNP will show critical electrolytes, specifically potassium levels. Now, very lastly, a urine analysis can be done to assess for ketones in the urine. Now, moving on in our case study, the assessment findings, we have a blood glucose that is 1200. Wowza! So normally it's 70 to 110. So over 1,200 is intense. Now the heart rate is 110 and regular, so that's a little fast. Now the BP is a little bit low, 90 over 58. This is from the dry body. So remember, 120 over 80 is considered normal range. So anything less than 100 systolic, or that first number there, is very alarming. The next assessment finding is a respiratory rate of 34 that is labored. So it's very fast, because normally it's 12 to 20 respirations per minute. And the key word here is it's labored. So it's very possible this client has these Kussmaul respirations. Now the ABGs are as followed: a pH of 7.21, a PaCO2 of 33, and an HCO3 of 18. So using our marching band suit method from the full ABG video, let's break this down real quick. So step 1 is pH, because remember P for primary. So 7.21 is very acidic, as we expected with diabetic ketoacidosis. So very acidic. Now step 2 is to find that acid match based on the pH. So PaCO2 is 33. So that's base. Now step 3 is the HCO3. It is 18. So 18 is the acid area.
So that's our acid match. And the kidneys here tell us it's metabolic acidosis. So just as expected from our memory trick, it's metabolic acidosis. Now the CBC revealed white blood cell count of 24,000. Whoa! So normally the WBC count is between 5,000 and 10,000. So 24,000 is super high, indicating a current infection. Now the BMP reveals a potassium level of 6.8. Now you know normal potassium is 3.5 to 5.0. So 6.8 is sky high. So remember, potassium pumps the heart. So high pumps in the heart will lead to deadly dysrhythmias like VFib and cardiac arrest. Lastly is urine analysis. As expected, presence of ketones. So remember, diabetic ketoacidosis, we're going to see those ketones. Now the second question here. What is the underlying pathophysiology behind the client's abnormal vital signs? So pause the screen and try your best to answer this question. All right, let's break this question down. So before answering the question, always think about the memory trick here. In this case, it's DKA to recall the signs and symptoms. So look at the first D here. It's for dry and high sugar. So the correct answer is the client is dehydrated due to osmotic diuresis caused by hyperglycemia. So osmotic diuresis is the body's method for attempting to eliminate excess glucose from blood serum. So let me read that one more time. The body's attempting to eliminate that excess glucose from the blood serum. Just think of that blood as thick, syrupy mud. Just a lot of sticky, icky blood sugar. Now, polyuria is excessive urination, while polydipsia is the excessive thirst that results from fluid volume deficit. Okay, hopefully that made a lot more sense. Now, moving on to question 3. What is the underlying patho for DKA in clients with type 1 diabetes? So remember, DKA is a type 1 diabetic problem. So let that guide your thought process here. So pause the screen and try your best to answer this question. Okay, so let's break this question down. In clients with pre-existing type 1 diabetes mellitus, or just DM, there is an absolute insulin deficiency. Remember, the body's killed the beta cells within the pancreas that normally produce insulin. So now the body can't produce insulin. Under normal circumstances, periods of stress such as illness, catecholamines are released, leading to an increase in blood sugar. Remember, during stress, we have an increase in sugar. So in clients with type 1 diabetes mellitus, stressful conditions cause an increase in blood glucose, but without insulin to counteract that hyperglycemia. Those are some big key terms right there. There's no insulin to bring down that sugar, so we get hyperglycemia. This client presented with a 3-day history of vomiting, suggesting that the underlying illness initiated this client's DKA. Now, moving on to question 4. What do this client's ABGs reveal, and what is the cause? So once again, pause the screen and try your best. All right, let's break this question down here. ABGs reveal metabolic acidosis, as stated before. The metabolic acidosis that's seen in clients with DKA, big key terms here, results from lipolysis, or basically a breakdown of fat for energy. The body switches from using glucose for fuel to using fat for fuel. So when fat is broken down for energy, these fatty acids are converted to keto acids, leading to a state of metabolic acidosis. So yes, kind of like going from clean electric energy within a car with no emissions when using glucose for fuel, and then switching to that dirty diesel that pollutes the body with those ketones when we're burning fat for fuel. Now lastly, question number 5. What is the body's method for compensation for metabolic acidosis? So remember, compensation is the body's way of balancing itself, or basically finding that common ground of compensation. So pause the screen and try your best to answer this question.
All right, so let's break it down here. Remember the key term, Kussmaul respirations. The client hyperventilates in attempts to blow off excess carbon dioxide, that's CO2, which I call carbon diacid, since all that CO2 pushes the body into that acidotic state. So the goal here is to bring the body from an acidotic state to normal pH balance by breathing off all that CO2 out of the body. So those Kussmaul respirations try to get the body into balance. Now for the practice questions on DKA and HHNS. So question 1. The nurse is caring for a client admitted with hyperosmolar hyperglycemic non-ketotic syndrome, HHNS. When the client asks why her blood glucose is so high, what would be the best response by the nurse? So pause your screen and try your best to answer this question in about 60 seconds or less. All right, so let's break this question down following the question breakdown strategy. So first, look at the key terms in the question. We have HHNS, and the client is asking why her blood glucose is so high. Now, number 2, always think of a few things you know about those key terms. So for HHNS, we know it's a type 2 diabetic condition. Because remember, DKA and HHNS. Just think, what letter comes first in the alphabet? Well, D for DKA. So that's how you know it's a type 1 diabetic problem. And H comes second in the alphabet, and that's how you know it's a type 2 problem. So remember, type 2 diabetes comes from insulin resistance. So now look at the options here. Option A says that extreme hyperglycemia results from absolute insulin deficiency due to type 1 diabetes mellitus. No, the key term here is type 1 diabetes mellitus, which in reality, HHNS is a type 2 problem. So remember, if one part of the question is wrong, well then the whole question is wrong. Now moving on to option B. Extreme hyperglycemia results from absolute insulin deficiency due to type 2 diabetes mellitus. No, once again, the key term is also used here, absolute insulin deficiency. It's actually from insulin resistance in type 2 diabetes. Now option C, extreme hyperglycemia results from insulin resistance due to type 2 diabetes mellitus. Yes, extremely high blood sugar from insulin resistance due to that type 2 diabetes. And lastly, option D is incorrect. Extreme hyperglycemia results from insulin resistance due to type 1 diabetes. So no, again, type 1 makes the whole thing wrong. Now moving on to question 2. The nurse is caring for a client admitted for diabetic ketoacidosis, that DKA. Which is the priority assessment for clients with this diagnosis? So pause your screen and try your best to answer this question in about 60 seconds or less. Okay, so let's break this question down, following our breakdown strategy. So number 1, first look at the key terms in the question. We see DKA and priority assessment. And number 2, think of a few things you know about those key terms. So use the memory trick DKA. Remember, D is for dry and high sugar, 250 to 500 plus. K is for ketones and Kussmaul respirations, that rapid fruity breath. A is for abdominal pain. And the last A is for acidosis, specifically metabolic acidosis, with a pH of 7.35 or less. Okay, now looking at our options. Option A, urine output. This is the most correct. This is the number 1 assessment and priority to see how dry the client will get. Remember, the first D is dry, so this is priority. Now, option B, C, and D are incorrect. Option B, those daily weights. Now, this is very close, but it's wrong. So listen close. Sure, daily weights can track water retention, but we want to track those I's and O's, that input and output, very closely for early intervention. So that's why option A, that urine output,
is the priority assessment to intervene for that dry. Now, option C, equality of radial pulses, this is incorrect because it's not the best priority assessment to assess for the dry. And option D, a rectal temperature, now this one is not necessary. The focus should be on fluid assessment and rehydration. Now, moving on to question 3. The nurse is assessing a client diagnosed with HHNS. Which manifestations does the nurse expect? So pause the screen and try your best to answer this question in about 60 seconds or less. All right, so let's break this question down following the question breakdown strategy. So first, look at the key terms in the question. We're looking for assessing the client with HHNS and manifestations to expect. So number 2, always think of a few things you know about those key terms. Once again, use the memory trick HHNS. So H is for the highest sugar, over 600 typically, and higher fluid loss. We're looking for extreme dehydration. H is for head change, or that neurological change, with manifestations like confusion. N is for no abdominal pain, typically, and no ketones, and not even acid or Kussmaul respirations. That's for DKA. And lastly, S is for slower onset and stable potassium. Okay, now let's look at the options. Option A, weight loss, increased urine output, and hyperglycemia. Yes, this is the most correct. So higher fluid loss and highest sugar. Now, weight loss typically means water loss, along with that increased urine output. And so that's why this is the most correct. Now, option B, weight gain, respiratory acidosis, and hyperkalemia. No, weight gain is not a manifestation. We're looking for weight loss because we have extreme dehydration with that water loss. And neither is respiratory acidosis. That's for DKA. So remember, the S in HHNS is for stable potassium and not hyperkalemia. Now, C and D are incorrect because C, increased urine output and dehydration with metabolic acidosis. Now, this one was really close, but it's incorrect. It's true we do have increased urine output and dehydration, but no on the metabolic acidosis. Remember, that's for DKA, that diabetic ketoacidosis. And lastly, option D is incorrect because hyperglycemia, ketoacidosis, and decreased urine output. No, once again, ketoacidosis makes the whole option wrong.
All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor.